Well, good morning. My name is Mr. Roger Rodriguez. I'm one of the instructors with the Pharmacy Technology program. What do we do here? Does anybody have an idea what a pharmacy actually does? A pharmacy technician? Anybody? It's too early in the morning.
Do they actually prescribe pills?
Well, we don't actually prescribe. The prescribing is done by the doctor, by the physician. We're the ones within the pharmacy that help the pharmacist get the medication out to the patient. So we have two different main settings that pharmacy technicians are deployed. We have the retail setting, also known as the community pharmacy, and then we have the institution, which is known as the hospital. It's better known as the hospital. So within those two different types of settings, we do a variety of things. Okay. Now, what I'm going to do is I'm going to first introduce a little bit about the program. That way you guys can get an idea of what is it that we look for, how the admission process, how the selection process is done, and the degree plan that we have. So we have two different types of degrees. We have a certificate, and then we have an associate's in applied science, pharmacy technology. What I'm going to do is I'm just going to show you the associate, because of the fact that the certificate is the same up until right here, the summer session. Everything below that is not included within the certificate. Now, for us, or for the students, the associate degree is a little bit more sought after. So a lot more people, when they come in, they are looking for the associate, not just the certificate, because of the fact that now we did some changes to our curriculum. Now we have compounding sterile preparations and the aseptic techniques. Now we are a NPTA, which is a National Pharmacy Technician Association licensed facility. So what that does is we're able to certify our students as IV technicians. Okay. Now we always tell our students, well, the more certifications, the better skill sets that you have, the easier it is to find a job. Okay. Hospitals nowadays, they do require technicians to have IV experience. How are you going to get that IV experience if you've never worked in a hospital, right? So you have that certification that kind of allows you to go from hospital to hospital. Because of the fact that right now the pharmacy profession does not have a set standard as to, okay, this is the exact requirement, okay? Most hospitals do their own certification, okay? What we're trying to do as an institution, we're trying to change that. We're trying to change the fact that now we're trying to set the standard and say, hey, look, everybody must have a IV certification. And that is going to change. So I know that the Texas law, or the Texas pharmacy law has changed that. Anybody who compounds or does any IV admixtures now has to have graduated from this type of program. Okay, has to have an IV certification. And that's coming in 2015, so that's a year away. So we're preparing ourselves. We're getting our students ready to go. That way, once they enter the workforce, they don't have to come back to school and redo this IV certification. So it is 2 semesters long, or 2 years long. I'm sorry. So you have your first semester, you have your second semester, and then you have your summer session. Your summer session, your practicum, is where you actually go out to the different sites, whether it's the community or the institution, and you perform some hours, also known as an externship. Right? You go out there and you work and you get some experience. By then, you should already have a good idea of where you want to end up, whether it's in the institution or the community. So you'll do 160 hours on each site, and you'll get to experience that before you actually go work. So it's kind of like try before you buy type of deal. And then you have your 3rd semester and then your 4th semester. Now notice that some of these classes down here are general education courses, also known as your basics, right? And most students, when they come into the program, they have these, the composition, the general psychology, they have those classes completed. So what we do is, rather than have the students come back for one more semester, we usually bump the last 2 classes that we have up to the 3rd semester, and they're done. So you're done within a year and a half, pretty much. And that helps a lot of students because of the fact that, most of them do want to start working. So it kind of speeds up the process. But, It's really up to the student on how fast they want to move. Okay. Now, let me switch over to this. Okay. This is our application. Our application period runs from February 1st through the last Friday of May. So May 30th at 5 p.m. At this point, the application is open, or the application period is open, and we are taking applications as we speak. Now, we are a non-selective program. What that means is we are a first come, first serve. So the first 30, first 35, first 40 applications that we receive, those are the ones that are complete. Those are the ones that we get. Now, we're trying to expand. Right now, we are at a capacity of about 30 students. Okay. Right now, we still haven't hit May, and we're already up to like 35 different applications. So we're looking to expand, and grow the program so that, students are not left out, right? Because we continue to move forward. Now, as we get closer to 2020, that is going to be an important year because of the fact that in order for you to take the exam, right now you pick up a book, you study, you go sign up for the exam, you take it, now you're a pharmacy technician. You pass, you're pharmacy technician certified. By 2020, PTCB, who are the ones who certify the pharmacy technicians, say that you can no longer do that. So in order for you to actually sit for that exam, now you have to graduate from an ASHP accredited program. So we are an ASHP accredited program. The only one south of Laredo and south of Corpus Christi. So we cover a very, very wide area. So what that means is as we get closer to that date, right, we're going to have to start switching over to a selective type of program. Because these counties of Hidalgo and Star register new technicians. The State Board of Pharmacy registers about 60 technicians per year. So right now, we won't be able to meet that demand, right? So that's what we're starting to kind of slowly but surely expand the program so that we're able to take in more students once that 2020 deadline comes in. Questions? So thus far, everybody good? All right. So what are our admission requirements? Well, meet general admission to STC. So everybody's here taking a class. You can go ahead and check that off as a yes. Have a high school diploma or GED. Be 18 years of age for clinical and practical experience. For the degree option for the associate, you have to be TSI complete or TSI exempt, meaning you cannot be taking any remedial courses. Earn a minimum GPA of 2.5. Okay. Complete program-specific requirements for clinical practice. That requires you to go get a background check. That requires you to go get a drug alcohol test. Have all your vaccinations up to par. So that we do have a clinical affairs specialist that helps the students to complete the checklist that's on there. Obviously, submit a complete pharmacy technology program application. Participate in individual student advisement with program chair or faculty, and complete program prerequisites. And what are prerequisites? Well, we have three. We have pharmacy or intro to pharmacy, HR 1301, pharmaceutical mathematics, number 1, 1309, and anatomy and physiology for allied health. So that is the only three requirements that we do ask that our students complete before they actually get into the program. So, pretty straightforward, right? Questions? Yes?
Is there any more besides those prerequisites?
No, that's it.
Or can we take like in other programs, if you take more, it's better for you?
Yeah, that's always a good idea. That way you can start.
But if you have those, you can go ahead and just apply.
Correct. So we only require 3. If you have algebra, if you have biology, things like that, we don't require that, but they do apply towards your associate degree. So, for example, if you had taken college algebra, you have a math or natural science elective. So it kind of knocks off your, general education down here. So it kind of speeds up the process for you. Okay. Any other questions? All right, so a little bit more on the actual pharmacy technician profession. The median pay, and this is based off of 2012, is about $29,000 a year, which averages out to about $14 an hour. Okay. Now there are different scales. You have your retail, and then you have your hospital. Okay, those are the two main sites that we have. Just those two. Retail, it all depends on where you work. You also have your independents, which are your mom and pop, Lee's, Signs. These are smaller pharmacies. Then you have your chain or your corporate, H-E-B, Walmart, CVS, Walgreens. So it all depends on where you end up. Now, in the retail, you can expect to earn anywhere from minimum wage up until 13. That's average. Okay, that's just depending on what work experience, what type of education you have. Okay, so you could fall anywhere in between that range. Okay, you could make more. It all depends on the applicant or the candidate. All right, so you're looking to make that. Now, in the hospital, you have you can be making anywhere from $13 an hour to $16, a little bit more. So this is why the hospital is a little bit more popular with the students, because of the fact that they're making a little bit more money. Now, within the hospital, you have your IV technicians, and then you have your chemo techs. Okay, and these are specialized fields within the actual pharmacy. IV technicians are making anywhere from $16 to $20 an hour. Can you guys see that over? They're making anywhere from 16 to 20. So again, it all depends on your work experience. It all depends on I guess your negotiating skills once you get out there and start to do your interview with your employer. And then your chemo techs are making anywhere from 17 to, I want to go up as high as $30 an hour. Now, we offer the IV certification. We don't offer the chemo certification yet. And I say yet because again, we're the type of program where we continue to improve and continue to look what's out there, what's missing, so that we can always provide that service to our students, right? So, so that's kind of a broad general statement in terms of the salary that you expect to be making. So that is why it kind of averages out to about $14 an hour. And this is based off the Occupational Outlook Handbook. So this is again a government website. Now we are expected to grow by 20% faster than average because of the fact that right now there is a big push for the actual pharmacy profession to get the pharmacist involved with the patient more. So what they want to do is now they want to have a clinical pharmacist, to where the pharmacist is no longer stuck behind the counter just dispensing medication, but rather interacting with the actual patient, okay, or doing rounds in the hospital. So if we have pharmacy technicians and pharmacists within the pharmacy, if you take out the pharmacist, who's left behind? The technicians. So that means that our workload is going to increase, right? And more workload, more responsibility equals more money. So we are the pharmacy profession is moving that way. So we're catching up with the pharmacists in terms of how they grew within their actual profession, right? Before, they used to be just bachelors of pharmacy. Now it's a doctors in pharmacy. So that is why they're trying to utilize those doctors in pharmacy as a clinical pharmacist, so kind of get away from the whole dispensing and distribution. Okay, so that is why we are expected to grow faster than average. Questions with this? Everybody good? All right, so now I want to go ahead and turn my focus to the actual labs. This is a setup that you would see in a retail pharmacy. So if you go over to Walmart, how many of you fill your prescriptions at Walmart? H-E-B? H-E-B. If you look back there, they have a similar setup to this, right? They have all their medications in shelves, And from here, the pharmacy technician comes over, it selects the medication that they need, and then they dispense it into a vial, place the label on there, and send it off, or send it to the pharmacist. Pharmacist checks, then it goes out the door for the patient. So again, we teach our students both aspects, because we don't know where they're going to end up. There's just a variety of things that the student can actually do, or a pharmacy technician can do once they graduate. We kind of make sure that we hit all the high points within the actual pharmacy. So this is retail, okay? Questions with this. Now over to the other side, we have unit dosing. This is what we have in the actual setting. So notice how we have kind of split between both of them, because of the fact that we do have both settings. And again, we try to train our students to be very, very good at what they do. So you have all your unit dose. In the hospital, it works a little bit different. Everything, notice over here, is in blister packs. So we have one little dose per package. Over here, we have bulk bottles. So we have, let's say this particular bottle contains 500 capsules. So this, again, would be retail. This would be in the hospital. Because of the fact that we do not know how long a patient is going to be there, we have to dispense everything by dose. If we were to dispense a whole bottle to the patient in the hospital, and they take off or they leave or they get better, we give them a 30-day, 90-day supply, 60-day supply, and they get better by 2-3 days, then guess what? We're already charged them. So we cannot take those medications back and put them on our shelves, because that belongs to someone else. Right? How many of you, if you ever got, if you go buy a cake, how many of you would expect to buy a cake that was returned by someone else? Nobody, right? Because of the fact that we don't know what happened to it, whether they touched it, whether they sneezed on it, whatever the case may be. So the same thing happens over here. So it's a lot more cost effective for us to send one dose at a time, as opposed to send the whole bottle, for the patient to use. So now, if you guys would follow me back here, this is our compounding lab. Yes, come in. So this type of setting is also in retail. Okay, now this would be more specific to a compounding pharmacy. So you have your traditional retail pharmacies that do not do much of your compounding. They just kind of go ahead and dispense that, and those are your Walmart, H-E-B's, Targets, things like that. Your compounding pharmacies would be things, or places like Lee's, Signs, the independent pharmacies that do provide that service to the public. Now, compounding for us is big. This region within the United States is one of the only regions that support independence, because of the fact that they do provide this service to patients. And this compounding, we specialize to whatever they need. So for example, if for whatever reason a patient cannot take any medication orally, they cannot swallow, and they don't like needles, so really we have to figure out and find a way to get this medication to the patient, right? So we say, okay, doctor wants a suppository. But the only problem is that the suppository is not available in a certain strength that the doctor wants. So we need to compound and make that for that patient. So we compound something that is not available commercially or through the industry, and then kind of fit the needs for every single person. So very, very similar to a chemistry lab. Those of you that have taken a chemistry lab, this is again very, very basic material that we use to compound. Now, during our second semester is when we actually do a lot of our hands-on training. So that is why the second semester kind of becomes a little bit more popular with students, because we're, first semester, we're pretty much lecturing and letting you guys know about the laws, the medication, the calculations. Then after that, we kind of apply what we learned the first semester over to your second semester. So we do compound a variety of things throughout the semester. What I have over here is I have some lip balm, okay, so chapstick. So notice that they do work as, a regular chapstick, right? We also have some suppositories that we compound, so I don't know if you guys want to touch that or pass it around. But, we don't actually use any real medication. We use simulated medication, but, it's very, very close to pretty much everything, right? Because of the fact that, if someone was to go apply a lease or, signs or whatever the case may be, they have to be able to know how to count up, because that is going to be expected from you. So it's a lot easier to do it once and say, okay, I've done it before, as opposed to, I've never done this. What do I do? Okay. So we have all our equipment, all our medications down there, everything that we need to count on for a particular patient. So we do suppositories, lip balms, lollipops, laxative, chocolate laxative, so just a variety of things. And again, we just make sure that the students get some real hands-on training on this kind of stuff. Okay. Questions? You guys want to follow me to the